measuring. My doctor probably only cares about a very small portion of that, right? And the presentations that I look at of this information are going to be very different than the presentations that she's going to want to look at. So as a designer, again, I say we need to understand what of the things I need to understand what she cares about, right? Because I care deeply about what she cares about, and I will gather whatever she cares about, and then I would like to see some sort of product or system that can present that information to her in a way that is relevant and validated. So does that answer your question?
Just to add to that, I think it's a little early to tell for sure, but I think the system, for lack of a better word, is evolving in that direction. There are a couple of forces at play. One is, while the electronic medical record has been largely an institutional data repository and has been used even with the federal subsidy dollars to support care management and meaningful use reporting for hospitals and medical groups. It's basically, we've succeeded over the course of the last 4 or 5 years in laying the first foundation of data collection, digital data collection, at the hospital and physician level. And that is no mean feat. I mean, it wasn't that long ago where you walked into a doctor's office and the file cabinets that stacked up behind the receptionists were 15 feet long and 10 feet high, and that was only part of it. The infrastructure that we see in place now is a means to an end. Right now, healthcare is working on interoperability standards. For example, FHIR, which is a web-based API designed to support much more real-time exchange of granular data between healthcare applications and between customized applications, where we're starting to see that where the data are kept is secondary to how the data are used. So as we evolve the implementation of EMRs, as we advance these interoperability standards, you should be able to have an app that is designed as you've designed your app. It draws on data from multiple sources, and you may want to submit data to 23andMe, you may want to submit data to a registry, you may want to submit for a clinical trial. But what we're seeing, I think, evolve is that organizations are going to be custodians of parts of the data, but individuals are going to be the stewards of their own data. That's the only way to address a number of huge problems. One is, how do you know the patient is who they say they are? The whole patient attribution challenge. Well, it's a whole lot easier instead of all these algorithms that the patient actually says, I will authenticate myself. I will prove to you that I am who I am. And I will steward the management, transport, and integration of my data. But if I authorize my physician to use an Apple Health Kit application that's been validated and is secure for a physician view of my information, then I can basically authorize that. The physician knows that I'm the person authorizing it, and they can have an application that looks at all these data wherever they reside in a view that's meaningful to them. But I think it's not a long way off, but I think we're seeing the first instances of the evolution of a healthcare data model that's much less enterprise-bound and much more capable of operating. Why shouldn't the medical record be like Facebook? Why shouldn't I have the people, or Salesforce.com, who's opened an entire healthcare division? Why shouldn't it be like Salesforce, where I can have those individuals, organizations whom I want to have particular types of access to my health data, regardless of where it resides? Give them particular access so they can build their own apps and they can use it for whatever purposes they want. But I'm the one who manages, I'm the steward of my own health data. I think we're evolving in that direction. I think we're just seeing the first growing pains of having the infrastructure built and people saying, I want the infrastructure to do what the end goal is. And it ain't, that dog don't hunt. It's really the first layer of what will ultimately, I think, be a much more distributed and patient-centric health information system. And I think that gets to a number of the kinds of challenges that many of us confront when we try to deal with these edifices who have Epic over here and eClinical works over there and whatever over here, and we expect them to talk to each other. They're not going to get there. But they will be able to talk through me and through these new emerging interoperability technologies in a way that's useful for me. So I would just throw that as a thought out there for people to consider or project.
What is very valuable to actually come to us? I'm very excited to know about just up to my research, just up to my knowledge. Well, as you guys are talking about technology, are you guys are getting into application? Are you trying to compare your application with WhatsApp and everything? Well, let's take an example of a teacher in a class. It's very but natural that a doctor is not going to focus on one of his patients. He does have a bunch of it. How is it going to be possible for the patient to reach out the doctor, to reach out and get the question and the answers answered by him? How is it going to be possible that the doctor is going to actually be able to give all the time when he receives the diagnosis, when he receives the text message or whatever it is? It's going to be pretty difficult for a physician to be actually able to give so many hours into it. And secondly, when you talk about the data, are you talking about, when you talk about application, you can delete, you can post, you can do a lot with an application. Everybody knows, everybody here is familiar with computers. So there's a lot that happens into it too. So just for my knowledge, if you want to put it on this way, like, if for example, if you're the doctor, I'm the patient, I want to send you something. And so it just reaches you on spot, you are able to view it. Am I allowed to delete it? Am I allowed to focus onto it, change it, or probably, get an answer back to you at that moment? Or do I have to wait for a couple of hours, like the way it happens in reservations and everything? Secondly, when I put up an example of, well, as it's chronic, as asthma, as cancer, everything is very common in the United States and around the world too. If you put an example of, let's say, I'm 60 years old, I don't really have a great vision, I'm not very comfortable using technology, I'm very not comfortable, I'm not exposed to all of this. How would you actually be able to develop this for people like, who are not used to it, who don't know how to upload, how to actually send a diagnosis, how to let the doctor know, how are you going to take the connection gap out of everything, like keeping it very simple and very convenient for everybody, not for some very selected people, but like everybody around the place, so you can actually grow it faster. Because I actually heard a lot about technology, I heard a lot about healthcare, and once again, it's a very brilliant idea which actually got up to my notice, and I'm very excited to know more about it. So if you can ask a couple of my questions, I'll be appreciated.
Can we repeat the question?
I
Can we repeat the question?
No, like, I'm not talking about with you, like, in general,
Let's repeat the question.
I resemble that.
You gotta capture some.
So we have some relevance to your question. Thank you very much for the question. So our system, first of all, it's designed, and this is fairly impossible in technology to be as responsive as possible. So you mentioned that you submit something to the system and you expect you wait 2 hours, you wait. So we're not actually waiting on a human response. So our system is a constantly real-time rules engine, so it's supposed to give you a response right away. Now, it comes at the drawback of there isn't a human on the other side. Usually, you can configure to do so, but generally speaking, you submit your health kit information, your Fitbit information, it goes to our system. And then if there are rules configured to give you an assessment afterwards, or to send you a document, or to say, just congratulations, it'll do that immediately. So that's basically how we have decided to tackle what you're saying. However, it's not exactly talking about healthcare data. It's basically your own voluntary data, as you guys were talking about earlier, and how we react to it. I'm not sure if that helps you at all with what you're asking, but that's our take on it. It was more of just an automated approach. Yeah, exactly. So someone with expertise would configure the system to react appropriately, and then the system would take it from there. So that's how we've done it. To answer your other question about how we handle people with disabilities or don't know computer very well, we've looked into using Amazon Echo, which is essentially voice recognition. And they have an open SDK and API to be able to take either verbal assessments or handle their verbal tasks over through text-to-speech.
Right, so to follow up on this, right, we are also involved in a couple of projects where we are looking into those conversations, right? It's either between the providers or between the patients and the providers. And we are, one thing to do there is to classify those incoming messages from patients, for example, right? So then the technology is really, the computer is really understanding those incoming messages and can kind of tease out what's the criticality of this message, right? Should it be communicated right now to somebody, or can it wait until tomorrow until your doctor take a look at this? So that's one thing. But I was involved in several projects, several studies that we did on telehealth. So it's helping people manage their complex health conditions in home. We did a couple of studies on heart failure. All elderly people in homes, so they would have technology devices like blood pressure cuffs and different other things that will communicate somehow with the doctor in the office or with the nurses in the offices. And those studies were not super successful because of those technology limitations. I think we're definitely go beyond that very soon, but technology was actually one of the major barriers there. There was this question how appropriate this thing is getting sent to the provider, right, to the doctors, nurses, vital signs, for example, right? The technology should be smart enough to know where those things are excessive, not in the range, and it should somehow understand, was this thing abnormal because of the human mistake, or was it the real abnormal thing? So that's one of the issues that we'll get there. We'll make the technology better, but yeah, that's still one of the barriers right now. So.
A lot of this seems to depend a lot on patient compliance, and I think we know that the outcomes are the best clinical measure of intervention. But I think you have a lot of, at least in America, people with these chronic diseases that don't have that want or need or understanding to say, well, I know my sugar is bad, but I'll be all right. And then they lose a foot. And then, well, there's nothing I can do. So these things seem to be based on compliance, whereas some of the new models of care that are not as technologically advanced, such as the patient-centered medical home, are using nurse practitioners, case managers to get education out to diabetics and so forth. Are there ways that you can kind of build technologies that can excite those non-compliant patients?
So we've put a lot of thought into this as well, actually. So we've come up with a few different plans of approach. One of them is actually we've planned on, this isn't developed yet, integrating with a video mashup service to allow a wife or a child to try to motivate their father or mother or grandmother, what have you, try to do an emotional appeal. So the appeal might be, say to your father, I want to watch me at my wedding in two years, or something along those lines. You make a tearful video and that might motivate someone. The other opportunity is a gamification. Some people, you give them a point system, maybe even a monetary return that can motivate some people. So those are the kind of things we're batting around. If anyone has any other ideas, we're open to it. But those are the two we have on our roadmap now.
Not to sound too Malthusian about it, but in the face of people engaging a patient about how important it is for them to monitor their blood sugar and control their diet and get 30 minutes of exercise a day, and the patient still says, to hell with this, I'm going to smoke, I'm going to drink, I'm going to drive without my seatbelt buckle, well, they're going to die. And I think the reality of it is that the system is so big, and attrition is going. There's going to be breakage, and the price that people pay for this, much as they do for dropping out of school, is, guess what? The future is going to be pretty lousy if there is a future for you at all. And I think that's a cost that society has to bear for large, public utilities, large services, social, goods such as healthcare and education. Well, where you're going to have some who are free riders, you're going to have some who ignore the system. But if you're hitting the vast majority of the population and you're making strides with those who just need that added push, I think that's where you measure your success. I think, cruelly, in many respects, just because of growth in population, growth in complexity, the sheer cost of this, people are going to start saying, I want to get on a train that gets me from Boston to San Francisco in 4 hours. And I don't want $15,000 to $20,000 of my annual compensation going into healthcare. So, you know, that's going to push on solutions that have real economic benefit and have real clinical benefit. And if individuals decide, I'm just going to flout the system because I have poor impulse control or whatever, you know, you can only do so much. It's ultimately a very free will, free rider problem. And that raises
But
lots
that
of problems.
significantly to a lot of the costs that the public is bearing.
Yeah, and I think it is sunk. I think we just have to minimize it where we can around the edges, so it's not people who would otherwise, with a little bit of information and a little more help, be able to do something better for themselves.
So I just wanted to add that I think that with regards to this notion of motivation, and I was incredibly lucky in some ways that the consequences I faced for not taking care of myself, and I always took good care of myself, but the amount of change I've made to have these healthcare, you know, the health gains, my consequences were fairly immediate. And I think it's a really tricky question when you're talking about, you know, how do you give people information for some version of their future self that they don't even have in their consciousness? You know, that they're living now, and the pleasure of a donut, or the pleasure of a smoke, or the pleasure of, you know, a bottle or three of wine is so immediate. And, you know, I have to say again with this sort of notion of relentless optimism that I believe that there are ways that we can communicate information that can be effective, but I think that there's going to be different strategies with different people, and we have to be creative about finding the hooks in. You know, for some people, yes, it's a child, you know, it's a child that they care deeply about. And I do agree. I mean, I have known people for whom it doesn't seem to be any way in, and that's incredibly sad.
So, looking into your,
Mine's real quick. I just want to say that tools are available now that really weren't available even 5 years ago. So I looked at Livongo Health. I'm amazed at what you can get for $25 a month. And I think it's really hard for patients to do things when you talk in the abstract to them, but when they actually see those measurements, it starts to impact them. So I have a little more hope than the future, that the future might be brighter with these tools. It makes people more responsive, myself included.
Well, I found that, just to speak to that a bit, you know, any degree of positive change that I achieved, it was like winning something. You know, so if I could move things in a positive direction, if there was some sort, I did something, and then I know, you know, I eliminated gluten, and then all of a sudden, wow, you know, I feel so much better, or I feel a little bit better. It's hugely motivating, but again, I don't want to sort of generalize the way it works for me. I can't make that